So patients who are progressing on BTK inhibitors or BCL-2 inhibitors or both, they have very limited choices, especially if you look at the double refractory group of patients. A lot of times what ends up happening, and this is stuff that we've presented before, is that those patients are recycled on the original therapy. So for example, if somebody is progressed on BTK inhibitor and was treated with BCL-2 inhibitors like venetoclax, then if they progress after that, they go back on BTK inhibitors and vice versa. Sometimes they are used in combination with each other. So there's a lot of overlap. There's a lot of reuse of the same treatments that patients had previously tried and failed. So there isn't a lot of good option in that space outside of clinical trials, especially nowadays with the non-covalent BTK inhibitors looking promising in that space. So we basically wanted to look at outcomes of those patients, and in our previous work we have shown that the outcomes of patients who have progressed both on BTK and BCL-2 inhibitors is pretty dismal, and those patients don't do well, and they don't really have a lot of really good options, especially when you're not considering access to clinical trial, especially if you're in the community where there aren't a lot of clinical trial options for these patients. So we wanted to look at the healthcare utilization cost for those patients who progressed both after BTK and BCL-2 inhibitors, and we realized that the vast majority of the expense was driven by the drug cost. So inpatient cost, outpatient care cost is a small percentage of the total cost. So disproportionately, the cost is being driven by the actual BTK inhibitor or the BCL-2 inhibitor, which is reused in that setting. And a lot of times those patients are continued on that agent perpetually. And we are looking at roughly $12,000 to $14,000 a month, which is a substantial cost and adds up in the long run, because these patients end up staying on this therapy because they have failed both of those agents in the previous setting. So we really need a lot of work in that space to develop new therapies which hopefully are time limited and cost effective and can hopefully result in long, sustained, durable remissions.